we're gonna go ahead and kind of talk about stuff. I'm Kate. I'm going to be the moderator for today. If you haven't guessed by the slide, I kind of came to things via graphic design, but I'm now in public health and stuff. And so I'll be the moderator for today. And this is my lovely web of stuff that's happened either around the same time as being in the program or since then. And so I'm happy to take questions towards the end and be part of that. But for the most part, I do want to center on the other folks that are here from the other cohorts as well. And we'll kind of progress through people, a little bit of a chronological journey.
Program because I had the opportunity of networking with a lot of people and people who were well positioned in different institutions. I was also granted the opportunity of collaborating with the World Health Organization, the Pan American Health Organization, back in 2016. And we conducted the first regional report on the health situation of LGBTQ people in the Americas. So it was a big project. It was very interesting. It opened a lot of doors for me.
And so for me, you know, the thing I got most from the program was queer connection. So it really helped, you know, connect me both to folks who've helped me get published in anthologies, and also to folks who helped, you know, in terms of global scoping my work. And so I think like that kind of one-on-one connection and really starting to see where your work can intersect has been really valuable for me.
So it's been taking a pause on research, but I'm still doing analysis on some previous data. And like I said, a lot of my interest with research as well is just health equity and access to care, especially here in Florida. I think I'm really pulling from my training at GW. Really helped with understanding that foundation of policy work, as especially here in Florida, our legislative session has just started and we have hit the ground running. There are already several bills introduced to ban medical care. And so hopefully, I mean, not hopefully, I'm already using my skills and my training to help advocate and protect the care that we provide for our trans and non-binary youth here in Florida. And that's all for me.
Great. Thank you so much, John. And then Dee, you are next.
Hi, everyone. It's so good to see familiar faces. I know it's been kind of a weird 2 years. But yeah, I am part of the 2018 cohort. See a lot of familiar faces from my cohort. I started the program because while I was getting my PhD in community psychology at Wichita State University, and I was really interested in policy and LGBT specific policy, and I wasn't getting that in my university. So I feel privileged enough to be in this program and was able to use my dissertation as my capstone. I'm sure there's a lot more things I could talk about with work, but this program definitely gave me that foundation. I wouldn't have any opportunities to do policy work and doing the work that I do now if it weren't for the program. The people that I've met in this program, I'm still working with till this day. A lot of the connections I've made, people recognize me from this program. So I definitely think this was probably one of the best decisions I've done, is go through this program and meet some amazing people. So glad to be here.
Hi everyone, my name's Ray. I use they them pronouns. I'm really excited to be here, and I'm sort of blown away by everyone else and what they've been talking about and sharing. I'm also part of the 2018 cohort and really happy to be following John and Dee and hearing what they've been up to since I've last seen them. And in the midst of that, I decided why not take on another project and go to GW and learn more about policy and advocacy work. And like everyone else has said, it really became a life-changing opportunity for me. And I think more than anything, and it's why I put a picture of my son on this page, it became life-changing for me in that it changed how I viewed myself. It gave me a lot more confidence in who I am, to see other people doing the work that I do, to see other queer folks out here advocating and changing the world in these amazing ways, gave me the power to step into who I am and the work that I wanted to do. And I think that has been the most life-changing thing for me and for this and for what I'm taking from this program. Part of my capstone was sort of creating an outline for a book chapter, and I'm lucky enough to say that I was published, and that book chapter was published, and I'm really excited about what came from Pride Healing Center, and I'm really happy for what I learned from this program and policy development, because I think what a lot of the lessons from here into what I do at Northwell on a daily basis. But again, I think it's really the confidence that all of this has given me to be able to walk into a room with people with much larger titles than me behind their name, and know that I know what I'm talking about.
I think the faculty was super helpful in my context, because I was going through some personal issues, and they gave me all support that they could from DC while I was in Pakistan. And it's the kind of connections that you build with the peers, with your cohort. So at the moment, I'm in Amsterdam. I'm doing my MPH, and I was fortunate enough to come across this program because the foundation that was built with this program is helping me to date, and because it was easier to understand, considering me being a gay man and thinking, coming across all the resources and relating to them personally. So now it's kind of has augmented those skills that I learned during the program.
Like, it's never easy, but it's so rewarding, and I feel so like hearing everyone talk today. I felt like amongst such like it's just this call. There's so many people on here. It's so much power, and it makes me really excited to have been able to be a part of like this program. And I know 100% that like where I am now and what I'm doing now is so much rooted in like this program. It was not in my like teaching. It was in like the radical ideas that I learned in this program and people who I met with and the networks that have like pushed me to like think differently about myself and the world and the work that we do. So I'm really thankful for Steve and Kat and others who've been part of this program from the beginning. Like, congrats.